Damian Pardo, and I'm your host. And Forward Miami is a local organization that works on a lot of different issues in the community. But the main mission of Forward Miami is bringing the community together. So thank you for joining us. And as you can see, I am wearing red today. And I'm wearing red in honor of World's AIDS Day, which was just 2 days ago. And so today in our show, we're going to talk about HIV and update the community. Now, some of you might be thinking, HIV, well, that really has nothing to do with me. Well, it may not, but HIV is a community issue. And the reason we touch upon a broad array of community issues is so that we all can learn and educate each other and become better community members and overall become a better community. So join me in welcoming Marco Aurelio with CAN Community Health. And CAN is an organization that works on HIV issues. They're a wonderful community member. They've helped sponsor the Gay Ocho Festival and a lot of other things in the community. So we're very, very pleased to have him here with us. Welcome, Marco.
Thank you, Damian. Thank you very much to you and all the people who are watching today this special show about World AIDS Day.
Wonderful. Thank you again for taking time and being here with us. Just to start, I thought maybe you could give us an update on HIV here, and in the nation.
Well, we can say based on the data of CDC that is provided by CDC and posted on their website, we can say that nearly 1.2 million people are living with HIV in the United States. Okay, and that also has like different numbers. In this case, locally, we can say that Miami-Dade has more than 27,000 people living with HIV. Broward have more than 20,000. The Orange County have more than 9,000 people. And Palm Beach have more than 8,000 people living with HIV, which is very important to say. The real concept now, the real term now is saying living with HIV, because it's a way more human aspect to say, you're living with HIV. You are not necessarily infected for HIV.
That's a really good point.
Yeah.
That's a really good point. I think it's also, as somebody who kind of grew up as a gay man in the HIV, world at the very beginning, I think it's also important to give a little context for maybe younger people who don't know. But there was a time when absolutely, if you had HIV, it was a death sentence and you were going to die. And the death was a very difficult, ugly death, frankly. And it was very, very trying. So this is a disease that thankfully never spread quickly. It wasn't as easy to get, but if you did get it, it was horrible. And it took a very long time for us to even have any kind of medications that helped.
Yeah, and also it has a toll on people because the stigma that was associated to it, all the discrimination that was doing through, many people got discriminated because their HIV status, not just in the US, also in Latin America and Europe. So it's very important to know, especially for the new generations, like if you go out there and you request a rapid HIV test, right? And you get a reactive result, and then you go out to a confirmatory result and you discover that you are HIV positive and you start living with HIV, you go under treatment. And once you are under treatment, you go to you reach the point of undetectable, untransmittable, meaning that a person can be living with HIV and cannot pass the virus, even by sexual transmission.
Wow.
Cannot pass the virus to another person.
You just hit a ton of really important points. When you say reactive, just kind of telling people out there, that means you got a positive result. So you went in for a test and somebody said you're HIV positive.
Yes, that can happen. But also, honestly, like some rapid tests can give you a false reactive. So for that reason, I spoke about the confirmatory test, which is something that is done on the lab, and you go and they check your CD4 and everything. So basically that. So
and when you say they check your CD4, I think it's also important for people to understand that that's a specific cell, an immune cell that you have in your body that HIV attacks, and HIV depletes those cells. And that's when you really get into trouble. Back then, I think the classification of AIDS was less than 250 of these cells. You were considered to actually have AIDS or to be immunocompromised to the point. What you're saying is that today we're kind of lucky because if we have such good medications that people can just have such little amount of virus that it doesn't even reflect.
Yeah, and the most important that people need to know that is that you can have access with or without insurance to your HIV medication, okay? And regardless of the immigration status, you can also seek for help and take the control of your health, you know?
Explain
That's
that
very
a minute.
important.
Yeah, that is. Explain that a minute. So if I'm worried about immigration, if I'm worried about remaining kind of out of the radar, how can I go about this? How can I go about getting a test? And what, first of all, why do I need this? Why should this even be important to me? If I'm not gay, if I don't think that I'm at risk, why do I care?
Because we are part of the community. We eat all from the same dish. We go to the same places. We interact with each other. And you just have to care for the other person. It's the right human thing to do, you know, and somehow. So, but that was the second question. The first question was about sorry, I got a little
no, thinking like if I don't think that I'm gay, if I'm just like straight.
Well, yes, you are not gay probably, but your son probably is gonna be. Your daughter probably is gonna be interacting with another man. Like we are not. Nobody is exempt to get any STI or HIV. Okay, because when we start to be sexually active, the thing is like you sleep with the whole, you know, with the whole historical of the person.
Yeah,
it's not something that is no one is isolated right now.
You sleep with the whole biological.
Yeah, with the whole biological trace. So, but the most important is to be aware of it. And I'm not throwing shade here to anybody because I know they're that kind of person. But we have to be clear and we have to talk honestly that we are sexually active right now, and we are still gonna be sexually active in the future. God bless. So the thing is like, we have to take care. We have to know about condoms. We have to know about undetectable and transmittable that can be reached within 3 months or 6 months, depends on each person. Also, we need to know about pre-exposure prophylaxis, which is a treatment of a pill that you have when you are HIV negative. You have to take it every single day, and it keeps yourself protected from HIV.
That sounds really like horrible.
But it's true.
What does it mean? Like pre-exposure what is that?
It's a long name. I know. It's like just protection pre-exposure. It's pre-exposure protection. We can call it like that. Okay. But it's also it's a treatment that allows you to love without fear. Without a stigma.
In other words, it's something that you take and it prevents the acquisition of HIV.
Exactly. So
and that exists.
Technically that exists and is affordable. You can have access to it through different social programs in the city of Miami, especially. Everybody can get it.
So question for you.
Yes.
If whether, obviously, if I'm straight or whatever I am, or however I identify my sexuality, I am at risk, potentially, of acquiring HIV.
Yes, everyone who is sexually active is at risk to acquire HIV. Remember, there are different ways to acquire HIV. Okay, blood transfusion, through sex, this is specifically the topic that we are talking today. So, basically, we are all at risk. I mean,
so question: if I can take a pill and prevent this, which is a chronic, lifelong, at this point, a chronic, lifelong disease, why wouldn't I?
Well, because first of all, is a personal decision to take it, to start going under that treatment. But the thing is that you have to be aware that we are in Miami. For instance, you and I, we are in Miami. This is like one of the places with the highest rate of new HIV infections in the country.
So Miami has one of the highest rates of
Broward.
HIV infection in the whole country.
Yes. Just not HIV, also STI. So there is a reality out there.
So
and HIV doesn't, probably you discriminate, not you, like somebody discriminate about sexual preference, I don't know, migration status or whatever, but HIV doesn't. So you have to be mindful, you have to be careful. Also, you in the future, at least if you decide to don't take it right now, you need to know like in the future you can meet somebody who is really special, who is loving, who is caring, and probably that person is undetectable. So you have to be able to love him or love her without fear,
Okay.
and you have the option to pre-exposure prophylaxis.
That's really easy to say, but in
It's not.
right. Right. In practice,
This is a whole conversation.
right. So when you were touching upon the word stigma, I thought it was so important because, as you know, there are many people that flat out say, I refuse to ever be with someone who's HIV positive. I don't care if the virus is detectable or not detectable, and I just refuse. Never will that happen. And so when you're talking about stigma, that's part of it, right? Because that's kind of irrational. That's really not based on any kind of science or reality, but it's just an irrational fear. And I think part of what stops people from testing is that, they're afraid they're going to be called gay, or people are going to think they're gay, or they're sick, or there's all these people are afraid of things that aren't logical, because you should want to have, especially if you're sexually active, have a pill and make sure that you don't get this and that you're healthy and that people around you are healthy. And if for whatever reason you're HIV positive, you're still healthy and you're under treatment, and can you talk a little bit about that, how that plays out in community?
Technically, when we are out in the community, especially with the LGBTQ plus community, we are very aware about the HIV prevention options. I think it's more from the other side of the coin, where we see more straight people saying, "Why I should take that?" And honestly, is what I am saying. HIV doesn't discriminate. Probably you feel special, probably you feel very different about this, but honestly, it's like we are having right now this situation where people choose to wear and don't wear a mask, right? But we are putting some other people at risk, even if you decide to don't wear a mask. So it's the same with going in pre-exposure prophylaxis and condoms if you're HIV negative. You need to do it in order to protect yourself and the person you love. Also, you can also say that you have a very exclusive relationship, and meanwhile you are in control of that, and the other person is very clear about that in the situation. That's cool. Maybe you don't need it. Maybe you are not a candidate for pre-exposure prophylaxis. Okay, but if you are not so sure about that exclusivity, definitely go on PrEP.
So you're saying if you're not sure you're 100% monogamous,
exactly,
and you don't have the kind of relationship where you have really good communication and you can trust, and 100%, which is really hard, I think.
I don't know. No,
for most couples, to trust at that level, I think is difficult. Then you're saying you might want to be on this pill.
Which again is something that people can have access, mostly with no cost in the city of Miami, through many different health and social programs. That information is confidential. It doesn't, in the most of the cases, it doesn't go to anywhere or anybody. All the health information is very confidential. People need to know that, especially my people from Latin America, my people who are immigrants here. So all the health information is strictly confidential.
So just as an example, I want to access this. I have no money, but I want to be able to take advantage of these. What do I do?
Okay, the first thing that people need to know here is that they can visit this website that is right here, right?
Conveniently available.
You can see canhivtest.org. Canhivtest.org. You have it down here. Now you can see it. You can go there and just request an HIV home HIV testing kit, which is gonna get to you within 3 or 5 days. Okay, depends on how the mail services are working. So
so you can do this at home.
You can do this at home,
and it's completely confidential. Nobody will know.
Yeah, once you go in that portal, you have to answer a couple questions. They're gonna mail it to you. Ken is gonna mail it to you, and you're gonna receive it at home. Okay.
And what if you get
a negative result,
we're gonna. What if you don't want it to go, home where somebody can open it?
Okay, well, that will depend on each person where you want to receive it. We're gonna send it to you and at the address where you specify on the form.
Okay.
But also, you can request one for you and one for your wife or your husband or whoever you prefer, and say, let's do this together and let's lower the stigma. That is an option too. Like if you are a father or mother and you have kids, children, and you want to start to educate them, um, this is the time. You can go to this website, get a free HIV testing kit. It's going to be delivered to your door. You can educate your kids about these
That's
topics.
a great idea. That's really a great idea.
So when the kid go out or the children go out, they can talk openly about these topics and protect them from a stigma and from the condition.
And if you're a parent out there and you're worried because maybe your kids, because a lot of times I think HIV transmission is associated with party drugs and circuit parties and just in general behavior that exposes people to unsafe sex, whether it's alcohol or party drugs or crystal meth or whatever the issue is. What advice could you maybe give a parent who's worried about a child who they think is sexually active and might be going?
Well, I know a parent. I have been out there in the community working with many people from different audiences. But I will say seek for help. You have social workers out there, some very affordable services in the city of Miami where you can go and talk to a case manager, get some help, get some resources out there. Mostly, some of those resources are for free. And then try to channel all your questions with this person, express all your doubts, and then check your options. But the very first thing that we need to understand is we need to address these topics. And thank you for that question, because we need to talk about substance abuse. We need to talk about HIV prevention. We need to talk about undetectable, untransmittable, especially within the Latino community and African American community, because sometimes we are very macho men about that culture, like, hey, a mí no me pasa nada, nothing is gonna touch me. So, but that doesn't happen for real. So start with the conversation, seek professional help.
Is there a phone number, maybe at CAN or?
Yes, we have this phone number for canhivtest.org, which is 844-922-2777. Look, the phone number is there. Oh my God, thank you. This is wonderful,
Tommy,
so fast. And the other thing is, like, if you don't feel like calling or expressing these doubts or these concerns on the phone, you can go to cancommunityhealth.org, right? And you can check the locations in Florida and Arizona where you can go and ask for these services. For instance, we have one location in Washington Avenue, and we have one location in Miami Gardens. We have two locations in Broward.
Yeah.
So you can go there and start the conversation about the HIV prevention and the HIV testing. The HIV testing is for free. The rapid test is for free. Many agencies are out there doing this work, doing the best they can. And also, like, if somebody has a community and they feel that they need to have access to these services, I am more than willing to bring a mobile testing unit that is going to provide HIV testing, like in Doral, in some area in Doral, Hialeah.
Oh, that's wonderful. So you have a mobile unit that can go out to places.
Yes,
so if people want to offer this as part of whatever it is they're doing, you can do that.
So we can help people and other organizations to provide these services within the community.
Marco, you mentioned that it was a big problem in the Latino, the Hispanic community. Can you touch a little bit more, on that?
Okay, yeah, let's go by the numbers that I have here in my notes. We have to be aware that right now we have, as I said at the beginning, we have more than 28,000 cases of people living with HIV in the Miami-Dade County. From that number, more than 13,000 are Hispanics.
Wow.
Yes. And part of the other community that is affected is for in a number of more than 11,000 are African Americans. So we have to get
The
together on
minority
this.
communities.
The minority
primarily
communities.
hard hit.
Yes.
Why do you think that is?
I think it's access to this type of education, sexual health education,
Sexual health.
resources. And when we talk about resources, it's not like just saying like, oh, well, this is free, people should know, and all this. It's just like sometimes, as I don't have access to health services, I don't have access to proper or a specific education. It's like I think like everything is gonna cost me something, or everything is gonna how can I say? I forgot the name in English. Oh my God.
What is it?
Prelar. Like something is gonna forbid me to get access to my health or get testing for free, and that is not true. People need to know that there are many services specifically related to the HIV prevention and HIV treatment that people can have it for free.
I think you also mentioned sexual education.
Or for a very low cost.
Or for a very low, that's important for people to know. But you mentioned sexual education, and I wanted to touch on that a little bit because it's so important. Because I think a lot of the problems we have regarding HIV is stigma, but it's also people who maybe are bisexual or are living, duplicate lives and somehow don't really want to touch upon the realities of the sex that they're engaging in or the health consequences of that. And so if they were to be tested, maybe the wife would think, well, why would you need such a thing? Or I just find that especially in the minority communities, transmission is often linked to a lack of awareness just with health.
Yeah, there can be many causes. That's also that you are naming there probably is a lack of acceptance of what we like, what we enjoy, regardless of the label that we have been taught in the past. So if you're going to have sex, make it safe, do something like it's going to protect you and it's going to protect the person you love or the other ones you want to love too. So,
or your children.
Yeah, and
that was a big.
Yeah, because also when you start to have access to this type of education, I think you're gonna be able to have this conversation within your house, within your home. So I think that's key. Also, you can have right now, as you can tell people, I have an accent because many of these services have also a lot of people who speak Spanish working out there for the community. So you can go to any of these services, also in Ken or any other agency in Miami. You can go and have access to these services in Spanish. Vaya para acá, mire, llame. Do it at home, lo puede obtener en español o puede ir a la agencia que está en South Beach o North Miami o en Broward y le hablamos en español allí.
That's perfect. And that's important for people to know, whether it's, you want your education or services in English or in Spanish. I think what you're trying to tell people is no matter what, reach out. There's a whole system there that's really meant to support you and help you through all of this.
Yes, and also like sometimes when you go to these clinics, you can have access to other services. For instance, in the location in Washington Avenue, we have dental services for insured and uninsured people. So let's say that you don't have an insurance, you're probably going to get a 20% discount in the total price or the price for the work that you're going to need to be done in your mouth. So I advise people to go on our website, check the address of the Can location at Washington Avenue, and you're going to probably get a free HIV testing and an estimate of what you need to be done.
Let me ask you something. With COVID and the pandemic, how has that affected? I mean, from a kind of big picture point of view, I realize that COVID is a very similar virus to HIV, and I can help. A lot of people don't know this, but when HIV first came out, an entire presidential administration never spoke about it. So we lived through the Reagan administration without the president once saying the word HIV. And then we lived through the Bush administration without the president ever once saying HIV. It was Barbara Bush with a baby that had AIDS that finally started talking a little bit about this disease that was killing thousands at that point. And I can't help see the parallels with COVID because COVID is the same type of virus. It's an RNA retrovirus. similar to, and I might be technically off with some word there, but the point is it's very, very similar to HIV. And I think as a country, had we dealt with HIV when it came to us, and had we put in 1/10 the effort we've put in with COVID, we probably wouldn't be dealing with COVID today. So I think it's important for us, for the same reason we were talking about not wearing a mask, or the people who don't want to wear a mask. Let's realize that we are a community and we need to worry about each other. And an issue that you think doesn't affect you really does affect you, you know? And the way we deal with COVID or HIV or whatever comes our way as a community is really important from a health perspective.
Yeah, I think it's a matter of understanding, love, and kindness. Like if I know I'm gonna meet my in-laws, I'm gonna go and get tested. Okay, so I think that's the matter on all this. Of course, this is a freedom of speech country and freedom of action. So but this is a personal point of view. It's a matter of kindness and love and understanding. Listen, I have the right to wear my mask, as you probably don't want to wear it. But I also have the right for my health. So let's be mindful about it. By the way, I was bringing like a group of masks to give here and to give you, but I left them in the car. So sorry about that. I'm gonna send it to you later.
Yeah, we'll get them to people if they want them.
Okay.
Absolutely. Thank you.
Yeah,
for
sure.
bringing
Like
that.
those who are commenting, this is going live right now.
Yes.
So those who are commenting, if they want a face mask, I'm gonna leave here a very nice package, like probably 30 masks. So if you want them, just start asking to people here, and they're gonna do the whole diligence.
I'm sure they will. I'm sure they will. A few people have asked and have wondered about, what do you think is the future of HIV, of where we're headed with all of this? I mean, if we've put all these resources behind prevention, and we've put all these resources in place, and we're still the fastest growing area of HIV transmission in the country, what's wrong with us?
Well, I don't know the future, because that's very deep question. So, but I know what I can tell you is that right now, HIV prevention, the HIV prevention field is in constant revolution. There are new organizations coming out, online services, online PrEP services, online HIV testing services. We have our own at Ken. We have our own online PrEP program. And as you said at the beginning, it has changed. COVID-19 has changed the reality of everything. So at this moment, we are scheduling appointments. So we have a minimum amount of people at clinics, all the locations. So it's safe for our clients, regardless of the service that you are requiring. Regardless of the reason why you're going to the services or to the clinical setting, we are taking care of that. And everybody's wearing a mask inside, and you just see the doctor or your nurse in different places. So it's the minimum risk possible. So, but right now there are many people working in the HIV prevention field. We are going electronically. So, and things like this, like canhivtest.org, that allows you to get the HIV testing at home. I don't know if we can put it again down here. Some people maybe can see it. Canhivtest.org is going to be super helpful. You can request one home HIV testing kit, or you can request as many as your family group are. So it's something, and it's for free. You just have to answer a couple of questions, and in English and Spanish.
And can you just address if they're positive? I mean, I think still people would freak out if they saw something positive. Can you give some context around that for people?
Yes. Before that, le quiero comentar a la gente en español que vayan a este link que está aquí abajo, ¿verdad? Que se ve acá, canhivtest.org, y allí se les manda una prueba casera de VIH gratis, confidencial, a su casa, ¿ok? Y usted puede requerir allí tantas como desee. So, about this question again. Yeah, because it's important to deliver to my Latin people. So.
Of course. Of course.
So you were asking me, what's the question? Oh, in case somebody get a reactive result,
Exactly.
they will contact us to this phone number, or somebody's gonna be, they can do the HIV testing with somebody on the phone, and we're gonna help them to go to a place to get a confirmatory test, and then right away, we're gonna help them to get treatment.
So when
And don't freak out, honestly, don't freak out, because is HIV, living with HIV right now is like living with diabetes, or living with, it's like taking a vitamin every day. You're not gonna die, you're not gonna pass it to anybody else. I mean, honestly, go on treatment, talk to a doctor, and also it's like you're gonna be getting tested regularly, regardless of you're on PrEP or on treatment to get undetectable. You go to the doctor like every 3 or 6 months, so you know you're very well your HIV status, and you know, like, if you have any other STI or if you have any other complication, it's gonna come out on the test.
So any sexually transmitted disease you guys would also handle? When you say STI, it's any other, I mean, herpes.
What we cannot handle, we refer. So what does that means? So if we cannot help a person with something in a specific, we're gonna put that person in contact with the agency that will help the person.
Perfect.
I have to be totally honest.
And I have to ask you, because obviously you're in, this is not just a job for you. What about this appeals to you? Why are you doing this? Why are you here? You're Venezolano, you're here working in the community, you deeply believe in this. And
I think we all have, I feel we all have talents. We all have an amount of love that we want to put out there. At some point you dream with that baby boomer place where you can go and be in an office and be corporate and success.
and just tell everyone out there, please, get involved, learn about all these issues, and we'll see you next week. Thank you for being part of the show.
Thank you.